I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Burke said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Caucasian women tend to get breast cancer at higher rates than African American women. Yet, African American women tend to die more so from breast cancer than white women.
In African American men, however, the incidence of prostate cancer is almost 60% higher, and the mortality rate is 2 to 3 times greater than that of Caucasian men. In 2018, the rate of preterm birth among African American women was at 14%, which was about 50% higher than the rate of preterm birth among white women at 9%. Genetics, environmental factors such as smoking and alcohol use during pregnancy can cause children to have ADHD, along with exposure to lead as a child have also increased the likelihood of ADHD in children. Black women remain twice as likely to die from cervical cancer as white women, largely due to socioeconomic disparities and a lack of access to care. Positive associations were observed between frequency of hair relaxer use and risk of uterine leiomyomata among the long-term users. The stronger results for surgically confirmed uterine leiomyomata cases may be explained by the higher rates of uterine leiomyomata-related hysterectomy in the South, the region in which the prevalence of hair relaxer use was greatest.
This has been your Apple for the Day. Be your own health advocate.